So thank you everyone for joining the first acromegaly support webinar, built for patients by patients and supported by acromegaly.care. Today we have with us Ellie, a Wisconsin mom who was diagnosed with acromegaly in 2010. Ellie is here to tell you about her experience managing her breakthrough symptoms. Ellie is joined today by Daphne Adelman, a clinical nurse specialist at Northwestern University in Evanston, Illinois. Daphne will share her perspective on treating these effects, plus strategies for discussing symptom management with your doctor. Please note, Daphne and Ellie were paid a fee for their participation in this webinar by Chiasma. The webinar is being recorded and will be posted to acromegaly.care for future viewing. Please note this webinar is for educational purposes only and is not intended to provide medical advice. Every individual's medical situation is different, so any questions should be directed to a healthcare professional. At the end of this webinar, we have allotted time for Ellie and Daphne to answer your questions about symptom management. Please use the Q&A box in the lower corner of your screen to submit your questions on the subject matter that is being discussed during this webinar. To minimize any background noise on the line, I have placed all attendees on mute. We will do our best to get to everyone's questions. If you have additional follow-up or need for clarification on anything discussed today, please talk to your doctor or go to acromegaly.care for more information. Before we jump into things, I wanted to provide a little background on this webinar series. This webinar was brought about thanks to the collaborative efforts of the patients who brought you acromegaly.care, an online resource to support people with acromegaly and their loved ones. The website seeks to shed light on the challenges of living with acromegaly and was created with input from a diverse group of patients and advocates whose stories are told in videos, photos, and written essays on the site. We invite you to share acromegaly.care with your friends and loved ones who are faced with acromegaly. You can visit our website to sign up for our e-newsletter to receive regular news and updates from acromegaly.care. With that, I'll turn it over to Ellie.
Thank you so much, Catherine, for having me here today and allowing me to share my acromegaly journey with everyone. I only have a few minutes to share my story, so I am going to jump right in. If I had to sum up my life before diagnosis, I would consider myself an adventurer. I love to be on the go and active and outside. Some of my favorite activities were landscaping and gardening. You can see a picture of me landscaping in the corner there, and that was in college. I love rock climbing with my friends and hiking in the northern Wisconsin woods. None of these things ever seemed strenuous or out of the ordinary for me. They were just things that I did every day. Despite my adventurous side, I started getting headaches when I was about a senior in high school, which was way back in 1999. I saw a lot of neurologists up until my diagnosis, and I was in and out of the ER throughout college, but unfortunately I never had a scan done of my head. It was not until the birth of my first child in 2008 that my other symptoms seemed to explode. My headaches became extremely debilitating. I began to experience severe joint pain, and I was always just so tired. Also, another big symptom was that my shoes no longer fit. These things just were not me. It was not the me before the birth of my daughter. I remember laying on the floor in the bathroom when my daughter was taking a bath. She was about 1.5 years old, and I was not able to lift my head off the floor to wash her up, and I just kept thinking this is not normal. I had been told by so many doctors that I just had, daily chronic headaches, and so I just kept pushing off going to another doctor because I thought it was all in my head. Many of the other symptoms I attributed to being a new mom, especially the change in my feet size and the fatigue. It's, very common for your feet size to change while you're pregnant, and, you're tired when you're a new mom and you have a new baby, but those things just never went away for me. It wasn't until early of 2010 that I was finally diagnosed by my OBGYN, who recognized how much my physical appearance had changed, and she connected that with my headaches. So she actually had done part of her residency at the local medical college and hospital endocrine clinic, so she was able to directly set me up with the pituitary tumor program here. And it was determined that I needed surgery to debulk the tumor, and then I would follow up with radiation and injections as needed. If it's possible, My quality of life kind of seemed to decrease after everything. Even after starting both monthly and daily injections, my symptoms and growth hormone levels soared. I just never could seem to get control of my symptoms, and new ones just kept adding on. My headaches, my joint pain, and my fatigue returned. I gained 75 pounds. Everything on me was swollen, all my joints, my hands, my feet, my facial features. And, you know, while the change in my physical appearance was extremely difficult to manage, all the symptoms that people couldn't see were the most challenging. The constant fatigue and the joint pain caused me to miss so many events in my family and friends' lives. And I never really wanted to disappoint people, but I also never wanted to be considered a whiner or complainer. There's just no way for you to explain to somebody that's not going through this what it's about, and I think everybody can kind of relate to that. One of the saddest moments for me is I was at the park with my daughter, and she saw this other mom running around with her little girl, and she just came up to me and she wanted me to chase her around, and I had to look at her. I was having a really bad day, and I had to look at her and say I couldn't, you know. It was enough for me just to get to the park, and she just had the saddest look on her face, and I just felt terrible as a mom not being able to do that with her. And there's no way to describe it to your children that you can't do the normal things with them. Oops, sorry about that, guys. So it took almost 5 years for me to get this disease under control, but with the help of my doctor, we were able to kind of change up my treatment regimen, and we found one that's working for me. I take both daily and monthly injections. And despite doing both of that, I can still feel my symptoms return at the end of my monthly treatment cycle, and that happens about a week before my next monthly injection is due. I experience some pain in my joints lock up, my headaches return. I'm definitely more tired than I was at the beginning of my injection. My husband, who you can see in the pictures, he'll tell you that my acro rage returns. I'm definitely not as patient as I normally am towards the end of that month, but for the most part, I'm able to live most of the month like normal, and that's an absolute blessing for me. I don't take any of those days for granted, that's for sure. I'm out there as much as possible, climbing the Knox Mountain and digging in the dirt and playing with my kids, and I really feel like I've conquered this acro disease trail as much as I possibly can, and I'm just living life as best as I can. And this is just like a tiny touch of my story. I think we all have pretty long ones. But with that, I'm going to introduce Daphne. She's a nurse from Northwestern University, and she doesn't directly care for me, but we've met a few times, and I'm really excited to have her here and talking to us about the patients she treats. So, hi, Daphne.
Hi, thank you so much, Ellie, and thank you everyone for joining us this evening. I know we've all had busy days, and we appreciate your time to take out for this important presentation. So my name is Daphne Adelman, for those of you that do not know me. I'm a clinical nurse specialist here at Northwestern, the Feinberg School of Medicine in Chicago, and I work mainly with Dr. Mark Molich, who has been an endocrinologist in the field of acromegaly for almost 30 years now, so he's considered one of the forefathers of acromegaly. And I've been lucky enough to work with him for the past 15 years, and in particular with acromegaly patients, which is my niche because I'm a big advocate for just trying to make their lives a little bit better. And right now we manage anywhere from it varies from 50 to 70 patients at our center, and we're considered a pituitary center even though we don't have a dedicated pituitary surgeon right now. But we're an academic center. So as Ellie had mentioned, towards the end of your cycle of injections, there's a phenomenon called the breakthrough symptoms, but unfortunately in the medical literature, it's not mentioned that frequently. And unfortunately, a lot of the doctors don't really recognize it as an issue. A lot of times, the patients will mention these kind of symptoms to me and other nurses because we've been seeing a lot of the patients for a while, and they, after a while you develop rapport, and they feel more comfortable with us versus the doctor who they see for 10, 15 minutes at a time. So, and they don't like to complain to the doctor. They won't, if you're with the doctor for 5, 10 minutes, a lot of times you'll tell them what's going on, but, and then plus the doctor sees your labs and everything looks pretty good that you're, controlled in his mind. So anyways, we do have some patients that do experience some breakthrough symptoms, usually about the third week of their injection if they're on monthly. And these might include some hot flashes, fatigue, temperature control, pain, swelling, sometimes some sores on the tongue, definitely headaches and cranial pressure. They just feel run down. They have swollen joints, depression, again, the breakthrough pain, rapid heart rate, and then they just don't want to do anything. And Ellie alluded to that acro rage, which some are just very impatient. So that usually tends to happen about almost at the fourth week. So of the 25 patients that I do see at Northwestern, personally, I would say about 15% of them complain of this breakthrough pain. Most often it's usually headaches, joint aches, pain, fatigue, irritability, and swelling. And while every patient is different, this is some ways that I've told patients what to do. So I'll encourage the doctor to decrease the length of time of the injections or the dose. And then I tell most of my patients to try to take whatever they can to relieve those symptoms of the pain and headaches. So over-the-counter Aleve or Tylenol is always a good tool. And then one of the other things that we sometimes forget is that we just got to remind you all to take your medicines. Sometimes we know all who we are. I'm not the best with taking medications myself. So if you don't take your medications, your other medications as well, like some of us are also on thyroid and other hydrocortisone, other medications for the pituitary. If you don't take those consistently, then it just snowballs into not a good thing. So I always want to make sure my patients are taking their medications as well, in addition to their somatostatin analogs or whatever injections they are on. And I think the main thing I just want to reiterate here is that don't be afraid to tell us that you are having these symptoms, be it your physician, your healthcare provider, the nurse, whoever. I mean, a lot of times we don't know what's going on if you don't tell us. And maybe there might be a discomfort level, but you know what? You got to learn to be more of an advocate for yourself, because you're the only one that knows that you're experiencing these things. So definitely, these tools can help you, but if we don't know that this is happening to you, we can't help you. So definitely, advocate for yourself. And so now we are going to open up the floor to Q&A.
Yes, thank you. So we invite you at this time to submit your questions for Ellie and Daphne. Please remember that every individual's medical situation is different, so any treatment questions should be directed to your healthcare professional. You may continue to submit questions while the Q&A session is in progress. And with that, I'm going to ask our first question, which is for Daphne. How do I best describe my acromegaly symptoms to my doctor?
So a lot of times, when you experience the symptom, I would write it down right away, because if you're not going to see your doctor for a few months, you're going to forget when this happened and how long it lasted. So one helpful tool is definitely jot down what's been going on. Like if you had a headache, give us maybe the time of day, how long it lasted, did you take anything for it, did it relieve it? Just try to document whatever was happening to you, the symptom.
Great. And our next question is for Ellie. Ellie, how do you explain breakthrough symptoms to your loved ones?
Oh boy, it's very difficult to explain the breakthrough symptoms. I think I try to actually describe the symptom itself and then describe why it's happening. So for example, if I'm having a headache, I will tell them that I am having a headache, and then I'll probably go into the reason that I'm having that. My medication has been wearing off, and therefore my headaches have increased. That's the easiest for me, is to really simplify it as much as possible.
Great, thank you. Another question for Daphne. How come doctors do not treat symptoms more and just are numbers?
That's a good question, and I've asked them many times myself. But I think one of the issues is that they were trained to look at the biochemical markers. So they look at the IGF-1 and GH levels, and they see if it's normalized. And that's what the guidelines say. They do look at symptoms sometimes, but sometimes they don't even know that these symptoms are happening because nobody tells them about it. And then plus they want some type of tool that they can see, like some type of validated tool to document that the patient was having symptoms. That's why it's important to write down and bring things in. Just like if you're diabetic and we want to know what your blood sugars are. We're not, you can tell us the numbers, but it's always better when you have this, you've actually plotted it out, or, you can just do those downloads now. So data is very important to the doctors.
Thanks. Another one for Ellie. What advice would you give someone newly diagnosed with acromegaly whose symptoms are not yet under control?
Oh, there's a lot of advice that I would give people. Number one would be to form a really good support system. Everybody has different people around them, whether it be family or friends, or finding a support network online, or finding resources. I think that was the most helpful for me, was to get myself armed with information and armed with people that were there to support me. So that would be the first thing that I would suggest.
Great. So we have another question for Daphne. And Daphne, we have some folks that are interested in managing hot flashes and how to talk to your doctor about that.
I haven't had too many experiences with patients complaining about the hot flashes. So to be honest, I'm not sure what to do with that one. And then if anyone has any recommendations too, because I'm going to be menopausal soon too probably. So I'm not really familiar with that one. Sorry.
That's okay. I want to remind folks that you can, if it's specific to your treatment, you should talk to your healthcare professional, your doctor or nurse. And you can also visit acromegaly.care for more information. So we have another question for Ellie, and that is, how has living with breakthrough symptoms impacted your family, and what's that like?
Well, I mean, up until this point, we weren't able to do a lot of the things that we had done. My children didn't know me as an active person up until the last 6 months. So, the adventurous mom wasn't there. They didn't know that I liked to, well, they knew I liked to garden, but I would only be able to do it for a few minutes before I would have to stop. I wouldn't be able to go on bike rides with them, or I wouldn't be able to go on long walks with them, or there were so many different things that I wasn't able to participate in. And my husband is very, very adventurous, so he was always the one that would kind of go and do the active things with them, and I was the one that was staying at home. So it's very hard to, especially when you really like to do that stuff and you can't, it's very hard to watch that happening. And so it impacted us quite a bit. It really has been a nice change to be able to start to do some of those things again.
I think we have another question here for Daphne. My levels are under control. Why would I be experiencing breakthrough symptoms?
You might be, so basically, even though your levels are good, they might be on the lower end of normal, so, or the higher end of normal. With the IGF-1s, there's an array based on age and your gender. So what might be normal to someone else who doesn't have symptoms might be different with yours. It's very individualized with everybody. Someone can be poorly controlled and still not even have any breakthrough symptoms, so it all depends on the individual, actually.
Great, thank you. So we have one last question at this time for Ellie, and that is, how well does your current treatment control your symptoms?
Well, I guess my levels are in the normal range all the time, so I'm considered controlled. but at that 3-week marker, that's when I start to experience symptoms again for about a week before I get my injections again. So I do have some decrease of activity at week 3, and I always kind of know that that's coming. So I kind of jam-pack everything in to the 3 weeks before, and then just kind of plan around that 4th week and not being a good one.
Great. Well, I think that we have reached the end of our cues. I want to thank everyone for joining today's webinar, and a special thanks to Ellie and her tireless efforts to support people living with acromegaly. I also want to thank Daphne for joining us this evening and all that she does to help the acromegaly community. We hope you found this webinar useful and informative. If you're interested in sharing your story or know of local meetings in your area that you'd like to help raise awareness at, please contact us at info@acromegaly.care. Thanks, and have a good evening.